Hi, my name's Marisa and I'm from Arizona.
Hi, my name is Julio. I'm from Guadalajara, Mexico.
Well, Julio was diagnosed in 2008 with lupus SLE, which is systemic lupus erythematosus, in 2008. And the actual diagnosis process was really difficult because after 6, maybe 9 months of testing, labs, CBCs, like blood draws, they were unable to detect what it was that was ailing him. And the ailments, the physical ailments, were that he had a red rash in the shape of almost a mask here, a butterfly shape around his eyes, really itchy skin, rashy arms and legs, back, and severe joint pain. But the blood tests kept coming out inconclusive. Wasn't until about after 9 months that a doctor sent him to a dermatologist. And the dermatologist did a skin biopsy on part of his neck up here, and that came back positive for lupus. So he began treatment with prednisone and some methotrexate, which is a form of chemotherapy, but struggled years without really any improvement.
I was suffering with a lot of arthritis, and the pain in my joints was unbearable. I wasn't even able to move most of the time. I was in bed rest and also taking really high doses of prednisone alongside with the immunosuppressors.
And then in 2014, he began treatment with RCT, and in just a short time, I believe, he's been 7 months now. He's seen a lot of improvement, and he can talk about what he's felt. I can talk about what I've seen. So before Julio came into treatment here, as he mentioned, he was at a point where he wasn't able to work and just physically feeling bad every day. We had my family come and help us for a while, in and out of the hospital that he was with some visits, and we just, we didn't know if his outlook was positive. He was really thin, he didn't feel good.
And for me, being a performer for a long time and having this disease, that put me at a stop at some point. It wasn't good. Now, after I started the treatment and seeing the positive reaction with my body and being able to go back to work, I also been able to go back to my drumming, which is one of my passions. And if I had drums here, I will demonstrate that right now. I don't know what I could have do with my life if I wouldn't have that opportunity of doing what I love to do the most.
We just didn't know if he was ever going to be able to live a full life again, or if he would pull through this disease that can be so detrimental. The goal is to get it, like I said, to a dormant state, and now to see him full of life, it's just amazing to be able to cook and make meals and go to the gym. And he can't even keep up with the haircuts. I mean, he's once a month getting his haircut because it's growing so fast. The pain, he's mobile, he can stretch, he goes to the gym. Before, he would wake up in the middle of the night with cramps in his legs. Then he would wake up in the mornings with joint pain. He just couldn't even move his fingers or his hands or his knees. And to go from that to being able to actually go to the gym and run on the treadmill, it's just been amazing in a really short time. It's as if he's returned to the lifestyle that he had before he was diagnosed back in 2005, 6, 7, before diagnosis, when he lived as a normal person and was productive and happy and felt good.
Yeah, more than anything, this treatment has allowed me to go back to my normal life. Before, I couldn't move, I couldn't work, I couldn't do most of my everyday life. And as of now, I've been, like Marisa said, I've been able to not only resume my everyday duties, but also allow me to work, keep on working. I work as a chef as well, so that working with all those knives and the heat, near to the heat of the stoves, usually that before it will create a big deal of pain in my hands, whereas now that I don't suffer of any of that, I feel with more energy than before, and of course my overall look has improved.
Now he takes care of his diet, eats only healthy things. Being a chef, that's easy for him to incorporate what he needs in his diet, and then working hand in hand with the doctors here as well to talk about what helps keep inflammation at bay, what can help him to feel better. And he's at a regular weight now, regular 140 pounds, and feeling and looking good.
Actually, it was 100 milligrams of prednisone a day, then decreased to 80 milligrams of prednisone a day, and right now I am on 2.5 milligrams every other day, and lowering the dose until I can finally get rid of that.
That's fantastic.
Yeah, that would be great. So at this point, I would like to thank our city for the opportunity being given to me, and as you can see, after 7 months of this treatment, the way that I feel and the way that I look at myself every day in the mirror, I can tell you that I'm looking forward to see what's the outcome by the end of this year, and I can say that it's going to be positive 100%, because no other treatment have enabled to get me back to this point.